primarily on the piriformis muscle, which is a powerful muscle in the body that is very important for stabilizing your sacrum. And just in case you don't know, your sacrum is this bone, in your body, the end of your spine, the broad flat bone of your pelvis, and it connects to your pelvis, your ilium of your pelvis. And I'm going to do a little screen sharing for you so that we can take a look at this on my computer. So let's see. Lee, I can see you pretty well in your little tiny box. Can you see the anatomy app? Is it up? Okay.
Yep, it's up.
All right, great. So I wanted to just, briefly talk about this. Let me take away some layers here so you can see. So here's the sacrum right here, and here is the pelvis, the ilium, and the sacroiliac joint. If I remove all the connective tissue, you can see that this is the joint right in through here. And it's a very stable joint. It doesn't move much in the body. There's not a lot of mobility in this joint, and we don't want a lot of mobility in the joint. And I think a cool way to experience this is to see the sciatic nerve, which everybody's probably heard of. It's this big, huge nerve that runs down your whole leg, and it comes out through the lumbar spine. You can have problems with it there, but you can also have problems with it right around the sacrum where it comes out. And one of the reasons why you can have that problem is because the piriformis muscle, which is this muscle right here, lays right on top of the sciatic nerve. So when it gets tight, it can press down, and nerves are finicky. They get tender and cranky very easily. You know how you feel after like a night of 4-hour sleep and you just don't really want to talk to anybody? The sciatic nerve can get to be cranky like that very easily if the piriformis is pressing down on it. And so, because the piriformis muscle attaches from your sacrum all the way to your femur bone over here, it's very stabilizing for the pelvis and for the sacrum in particular. And so when we have imbalances in it, all sorts of things can go wrong. And what are the things that can cause imbalances? The way you walk, the way you sit, if you sit cross-legged a lot, if you sleep with, on your side with your leg thrown over all the way to the floor instead of to the bed instead of a pillow between your knees. There's lots of ways that if we carry kids on one side, if we carry purses on one side, if we carry a phone in our back pocket on one side, there's so many things that can disrupt our normal way that this muscle moves. So the primary thing it does besides stabilize the sacrum is it abducts the leg. So it brings the leg out to the side. And also when you're standing, it externally rotates. Like think of ballerinas turning their feet out. It does that action in the body. When we are standing up. When our hip is really flexed, it does just the opposite and internally rotates our leg. But when we're standing, it externally rotates our leg. So that's the muscle we're going to focus on today. But before I get rid of this app, notice how many muscles are all around here. You have your pelvic floor, you have a lot of deep muscles underneath your glutes, you've got a lot of back muscles. The muscle in our back that we're going to work with a little bit today is this one, the multifidus, that connects right onto the sacrum. And then if you layer more muscles on, your glutes are on top of all that. So there's just so many muscles that integrate with the piriformis to help stabilize our pelvis. And that's only on the back of the body. On the front of the body, we also have, we also have many layers of abdominal muscles. And then we also have this great, beautiful muscle, the psoas muscle in the front of our body that has a really beautiful relationship with the piriformis on the back. Okay, so the last thing I want to show you is just that there's a lot of connective tissue that involves, there's so many layers. So if I take away all the muscles for a minute and you just see how many ligaments you have that attach the sacrum. So here's the joint again, right here. And if you just notice, there's layer upon layer upon layer upon layer upon layer of connective tissue, that ligaments that hold the bones together. And when we overdo a lot of our yoga postures and try to push ourselves into extreme ranges of motion in our hips, we can destabilize a lot of these ligaments and cause loose joints, which are not so good for the SI joint. So that's your little anatomy lesson for the day. Bear with me. I know, not everybody's an anatomy geek like me. So I thank you for taking a look at what the inside of your body looks like. And sometimes when we have a visual, it helps us feel. So this concept of, our yoga practice is so important for learning how to be in our bodies and how to feel ourselves so that we can be comfortable, so that we can not only sense healthy movement and healthy presence in our body, but so that we can have healthy emotions, healthy mind states where we know how we feel, we know what we're thinking, we're aware. And this is the gift of our practice, to cultivate this awareness. And so I'm hoping that a little bit of anatomy can help cultivate that for you. All right, so let's sit up straight and tall. Be up on the edge of something. If you're sitting on a blanket or a bolster, and just take a moment to allow yourself the groundedness that is available to you when you're sitting on the support. So are your knees high? Can you keep them in line with your hips or a little lower? This is a nice place for the pelvis to settle. And then as you're ready, just take a moment to close your eyes and go inside. Rest your body. Depending on what you've done so far today, maybe it's, you haven't done much because it's morning. Maybe the mind is still in that quiet place, but maybe not. Maybe you hit the ground running today and your engines are revving. So let's take a moment to drop in to the quiet. Let's drop into the breath. Allow the shoulders to soften, the eyes to rest. And just feel at ease. Let that softness kind of drop down into the pelvis, feeling a groundedness, steadiness. Can you feel your sit bones? Are you centered on the sit bones instead of rocking forward or rolling backward? Can you notice if you lean into the left or lean into the right? Do you always cross your legs this way? Maybe you want to take a moment and recross them the other way and just see what the change is in your pelvis when you have a difference in your legs. Is there a different awareness, something different waking up? And then imagine that your pelvis is this broad ocean, a big old lake for you to rest within, and see if you can allow the breath to travel down to the pelvic floor. Allow yourself to yield, to root into your support below you, and find the rebound that lifts you through your spine. Is your diaphragm all bound up? Can you loosen just a bit to let your breath move? And then as you're ready, place your palms together at your heart and bow in. Soften, rest the eyes for a moment. Cultivate an intention. So, this deep center of gravity that is our pelvis. When we are feeling centered, grounded, connected to the earth, what how does that support your intentions, whatever your intentions are, whether it's something you're working with in the mind or at work or in a relationship or in your heart? Can a feeling of centeredness, groundedness support you? And let's release the hands and let's come onto our back. So as always, you need some props. But in the beginning, we're going to start with the pelvic reset. So we're going to start by needing a strap and a block. So have that close by. And at first, just lie down on your back. Come into this state of deep rest where the limbs can kind of move away from the midline a little bit. Let your joints have a big lake to swim in, each joint spacious. And know that it's never a waste of time to lie down on the floor and feel your body. Feel your breath.
And then let's stretch the arms overhead and find some length. Reach the right side, reach the left side, see what it feels like to come into some opening. Maybe you can feel your hips shift. So if you stretch one heel away, your other hip might hike up. And then the opposite. And just notice your hips can move a lot. Your pelvis, although the sacroiliac joint doesn't have a lot of mobility, we certainly can move our hips around. So just get into the side body, stretch things open, and then bring the knees into the chest and rock a little bit from side to side, swaying and feeling the back of the body resting on the floor. Okay. Circle the knees one direction a few times. See if you can sense into the sacroiliac joints. Feel your sacrum, feel the ilium, that part of the pelvis that connects to the sacrum. And then spiral your knees the other way. And just notice as you drop weight into one side and the other, can you sense where those joints are? So, we tend to feel them in the back of the body, even though they're kind of, not as back there as we think, with the joint itself is a little deeper in. But a lot of times it's hard for us to sense the back of our body. So let's just feel it here. Take your knees in toward your chest. Let's swing the knees open and swing them back to center and go on a trajectory of movement in your hip joint that feels natural. So there might be an arc instead of just straight out to the sides. And just let the hip joints lubricate a little bit and warm. And then notice, do you have equal range of motion in your two sides? Are there any snaps or cracks or pops that are happening in your joint spaces? How is your range of motion? How is your patterning? We all have, unique patterning. If you cross your legs, I bet you always put them in the same position. We have patterns, and that's a good thing. Our body likes to go on roads that are nice and smooth and traveled well. Right knee into the chest, squeeze the knee in, roll the ankles around, feel your feet wake up a little bit, spread out the bones of your feet and wiggle things around. And then switch sides, left knee into the chest, right leg long on the floor, and do the same. Move your ankle, wake up your calves, wake up your shins, feel some expression in your feet. And then relax the left leg out, spread out to a starfish, navel stretching out to your limbs, spread your limbs out wide, wiggle your fingers and your toes, take a deep breath here. And as you exhale, curl into a little ball, chin in, knees up. Couple more times. Inhale, open your body out wide, spreading your limbs. Exhale, snuggling up to the center. Last time, feeling the breath take you into expansion, feeling the breath take you into contraction or condensement. And then relax and put your head back down onto the ground and grab your strap. We're going to take the strap and put it around our thighs. So we're going to make a loop and put it around your thighs. And we're going to do this in 3 different positions. But I want you to stick to feet hip width apart, knees hip width apart if you're having any sacroiliac joint problems currently. If you have some sciatic nerve pain, some piriformis issues, some SI joint issues, then you're going to only do the position where you're taking the strap a little wider and your feet and your knees are going to be hip width apart. But if you're okay for today, touch your heels, touch your knees, legs are together, and the strap is snug on your thighs. Allow your arms to rest down and feel your body yield into the earth. Root your big toes and your inner heels. We're going to initiate this movement with some core. So feel your transverse abdominis. We're going to hug the hip bones toward each other a little bit. As we inhale, move your thighs into the strap, about 20% of your effort, and then release on your exhale and let the legs come back toward each other. Keep grounded through the inner feet. Allow the movement to be smooth as we inhale and move out into the strap, and as we exhale and release back toward the midline. The core initiates the movement, so we're not going anywhere without a little support. Stay grounded in your feet. Only about 20 to 30% of your effort here, so you don't have to go like gangbusters to push against the strap. One more time. Can you feel your sacroiliac joints? Can you feel the setting like 2 puzzle pieces snapping into place? And then relax and bring that back. Take the strap and loosen it just a little bit on the buckle and take your feet hip width apart, knees hip width apart. Same action, root the big toes and the inner heels into the earth. Initiate with the core. We're gonna move our legs into the strap with a gentle, smooth effort, and just as smooth, release that effort on the exhale away from the strap. Sense in, now that you have the movement pattern, sense into what this is doing to your sacroiliac joint. See if you can feel into the body. And if you're like, I don't feel anything, just know that something is happening and keep trying. The more we work toward understanding the sensations we feel, the more we feel. It's like anything, the stronger it gets. Your sensation, your awareness gets stronger the more you use it. And let's try one more time. Move into the strap on the inhale, root the big toes and inner feet. And then relax and melt it. Now we're going to take the strap wider. So loosen up the buckle a little bit more. Our knees and our feet are wider than in your hips. You might need to move the strap a little higher toward your knees when you do this so that you're stable. Stay rooted through the inner feet, big toes, inner heels. Initiate from your core. Feel the movement out on the in-breath, abduct the legs into the strap, and then as you exhale, a smooth transition to release that tension off the strap. Notice sometimes when we get wider, it's a little bit easier to feel if we're stronger on one side versus the other. So just notice, see if you can sense into the piriformis muscles. This is engaging them, trying to find balance on both sides, breathing in on the way out, exhaling to release back toward the center. And let's try one more time. Root the feet. Initiate from the core. Relax your upper body. Are you breathing? And then release. Take the strap off. Grab your block, and we're going to do 3 different directions, starting from the outermost and working our way in. So take the block at its widest height between your knees. And we're going to start stabilizing. I feel this when I start to move this. I start to feel my pubic symphysis, which is where your 2 sides of your pelvis join. We call it the pubic bone, but it's actually 2 bones that are connected with a strong cartilaginous disc in between. So as you now ground the outer feet into the floor, initiate from the core, and we're going to hug into the block. And you might feel the pubic bone kind of set into place along with the sacrum. And release only 20% of your effort. Sometimes, when I learned this, I was told to inhale on the assertion of hugging and to exhale on the release. But it's natural for me when I'm hugging in to exhale. So I tend to flow with what feels natural to me. So do the same. If it feels natural for you to hug in on the inhale, then hug in on the inhale. If it feels natural to hug in on the exhale, hug in on the exhale. We're smooth in our effort. The outer feet are grounded. Feel into this. What does your sacrum feel like? Can you feel some muscles hug on to the sacrum? And then the next step is to take this with the block at its middle height, or the middle width of the block between your knees. So walk your feet in a little bit more. Ground the outer feet so you're not collapsing into the inner feet. See what it feels like to initiate from the core, hug in toward the center. You might feel your pelvic floor muscles a little bit. You might feel the muscles along the back. The piriformis is actually the very backmost side of the pelvic floor. So it's like the back window of the pelvic floor. So it often, when we hug in like this, when we initiate with the piriformis, we often have a co-contraction of a lot of pelvic floor muscles as well. Root the feet, initiate from the core, feel your breath. Okay, and then relax. And now we're going to take the block in its skinniest height in between the knees. So walk the feet in so that you're hugging onto the block. And you might be more narrow than hip width apart now, depending on the width of your hips. So let's go ahead and hug in and release. Move with the breath. Notice if your pelvis tilts, if you have a posterior or an anterior tilt, you don't have to lock your pelvis in any specific position on the floor. If a little movement wants to happen, then let a little movement happen. See where your natural tendencies live. Okay, so this is a great sequence to do if you feel like you've gotten your SI joint out of place, if you have pain in your SI joint, or if you just feel like your practice kind of, was very one-sided or asymmetrical. This can be a good thing to do at the end of your practice as well to kind of reset the sacrum. Let's move the strap and the blocks out of the way. Bring your knees into your chest and rock a little bit. We have one more thing to do, actually two more things to do here on the floor before we get up and moving. So thank you for bearing with me for a little floor work. Put the block in between your legs at the place where you like it best. So middle height, skinny height, whatever feels good. And then we're going to lift into some bridges. So don't worry about coming into a really high bridge. We're really focused on what the pelvis is doing. So go as slow on the way up as you go on the way down. Notice, where do you want to breathe? Where do you want to inhale and exhale? Can you ground all four corners of your feet now? Can you feel a gentle pressure on the block without gripping it super tight? As you go up and down, can you sense if you have dominance? If one side is an initiator of movement on the way up, or if one side is an initiator of movement on the way down. Do you have a lazier side, a stronger side? What is your sensation? When you come up, can you feel the hug onto the sacrum? Can you feel so many of your muscles just give a nice snugness to the sacrum? All right, and then relax and melt that back down. Bring your knees to your chest, rock a little bit. All right, and then last thing we'll do before we get moving, take your right hand and scoop it onto your right shin, left hand to put it onto the top of your left thigh. And our knees are hip width apart and in line with each other. Nothing's moving. We're isometrically going to push our knees into our hand. So our left knee is trying to flex toward our chest. Our right knee is trying to move away, but nothing's moving. The knees stay in line with each other, and then relax. Switch sides. Right hand on top of your thigh, right above your kneecap. Left hand scoops underneath, below the kneecap on the shin. Knees are in line with each other, hip width apart. Press knees and hands into each other. So you might feel, sometimes I have dominance for flexion, so my left knee might get confused and try to follow what my right knee is doing. So make sure you're feeling opposition, that they're doing two separate things. It's like patting your head and rubbing your belly simultaneously. Switch sides. We'll do each side one more time. Notice how you are breathing. See if you can feel the two different actions. Flexion of the psoas on the left, engagement of the glutes on the right. And then release and switch sides. Flexion of the psoas as you try to move your right knee into the chest, but the hand is preventing it. Flexion of the glutes on the left. Do you have dominance? Start to know your dominance patterns. Okay, release. Open up your knees, swing them out, bring them in, and then roll over onto your side. Come up onto your hands and your knees and just enjoy freedom here. So here we are trying to get off the floor, all right? So just sense into what it feels like to spin your pelvis around, to roll around in your shoulders, maybe to move into some very traditional cat-cows. How is your breath? How is your sense of presence? Are you in your body? Are you in your breathing? Give yourself the gift of being here now. All right, great. And let's go ahead and anterior tilt the pelvis. So you can take your knees as wide apart as you want. Lift the sit bones and stretch back towards child's pose. Feel the deep rooting of the femur bones in the joints. And as you stretch back towards child's pose, allow the breath to imagine a wave running down your spine underneath your sacrum. See if you can feel the breath lift up the sacrum a little bit, like a hot air balloon, just buoyance underneath the sacrum on the anterior surface as you breathe. Let's walk the hands over to the left side of the mat. Open up the right rib cage. See some of those little muscles along your spine. Stretch open. And then walk over to the other side and open up this. See what it feels like to breathe deeply. Let the ribs open. Relax the neck. Stay grounded through the hips.
And come back up onto all fours. Let's find some of that cross line stabilization on the sacrum now. So take your left leg straight back behind you, your right arm out in front of you. And if this hurts your shoulder, you can always take your hand out to the side or even back behind you. You can integrate the back muscles regardless of where your arm is in space. Can you feel the muscles along the right side of the back and the left hip kind of hug onto the sacrum from above and below, from left and right? Feel into that stabilization. And then release and melt that down onto the ground. Change sides. Right leg is up in the air. Feel the core. So we're globally supporting ourselves instead of just relying on little muscles. Reach the left arm out or down, wherever it's going to go, and feel the stabilization. So sometimes when we engage the muscles on our back and our glute at the same time, it can make us feel like we want to arch our back. So integrate the core, navel to spine. See if you can feel that sense of global support. Are you breathing? Sometimes when we do these classes where we kind of get nitty gritty into anatomy, we can forget to feel the global nature of your body and your breath. So feel that. Place the knee and hand down onto the ground and find your way up into dog pose. Spread out your hands, root into the index finger mounds, the thumb mounds, and feel free to move around here. You can pedal your feet, bend a knee, sway a hip, move your neck, your shoulders. Have fun. Just play in your body. Get yourself warmed up, woken up, and aware. How do you feel? Enjoy the head below the heart, the inversion. Enjoy the forward fold. See if your lungs have a lot of room to expand here. All right, start to come into a little more quiet in the pose where there's less external movement and more internal movement. So lift the femur bones up and draw them back. Let the knees soften so we do not have to lock our knees out. And if your back is rounded, bend your knees more so you can feel your heart lift to the pelvis, long spine. Isometrically drag your feet apart on the mat here and start to feel those piriformis muscles along with some others kick into a wakeful state. Relax your neck. All right, let's walk your feet forward. Come into Uttanasana. Fold in half. Let your knees bend. See if you can lift the tail and let the sacrum follow the spine like a waterfall, following the spine down toward the head. Try not to get into a tug of war where your sacrum's pulling back toward your hamstrings and your spine is pulling forward. Let the pelvis tip. Spill the bowl of soup forward. Lift and widen the sit bones. Feel the pubic bone pass through the inner thighs, inner spiral your legs. And then grab your two blocks and put them underneath your hands and lengthen through the spine. Soften the knees now. So even though our legs are straight, we can have a nice softness in the knees so we're not locked out. Spread open the bones of your feet. Feel the four corners of your feet root as the arches lift to the inner thighs. Feel the spine grow in length. Still, can you tip the pelvis? Can you feel the elongation of the spine and the anterior tilt of the pelvis rolling over your femur bones? Exhale and melt and fold again. Bend your knees. Rise up, bringing the arms to the sky. Open up your chest. Lean back a little bit if it feels good. Cactus the arms if it feels good. Do what feels good here. This is such an awakening way to be. Find any position of the arms that helps you bring light into the heart, to wake up, to enjoy, to open yourself to gratitude, to space, to welcoming any possibilities. And then release and fold again and relax the head down. Release any tension from the base of the skull. Bring your hands back onto the blocks for a half lift again. This time, same as dog pose before, isometrically drag your feet apart. So ground all four corners of your feet, soften your knees, and then pull your feet apart on the mat. Nothing's actually moving, but you should feel a lot of wakefulness in the gluteus medius muscles and the piriformis muscles. Extend the spine. And then relax and let's melt down to the floor. Step your left foot back, come to a lunge. Extend the heart forward. If your sciatic nerve gets a little caught up on some things, this is a great floss for the sciatic nerve. So begin to straighten the front leg to whatever range of motion you're available to do. Tuck the chin toward the chest, and then rebound into a lunge, knee bending forward, back leg straightens. Coming back and forth. And the height of the blocks can help you straighten the leg a little bit more. If we're not too low to the ground, we have a lot more capacity to move our body. So just bending and straightening. And if this irritates your sciatic nerve, make sure you stop before pain. The nerves in the body like to be flossed, just like our teeth like to be flossed. If you let the nerve have a lot of slide and glide, it doesn't catch on fascia as much. It doesn't catch on all scar tissue and tense muscles. So we want nerves to be as free as possible. Find your lunge again, stabilize your legs. Maybe you need your right foot to come out to the right more. Is that more stable for you? So work your way up to crescent lunge with whatever leg stability you need. Find your way up with your arms too if you want, but remember, if your shoulders are not happy or you lose your breath, you can take any position with the arms that feels good. The back knee can soften. If you lock out the back knee, it's great to engage your glutes, but perhaps you're crunching your sacrum. See what it feels like. See what it feels like to maybe lean forward a little bit, to have a slight inner spiral of the thighs. Can you feel space around your sacroiliac joints instead of crunchiness? So there's a difference between jamming your joint and stabilizing your joint. So experiment with where you need your body to be to find that perfect balance. Okay, and then release and relax your hands back down onto the floor. Walk your back foot forward, fold again. Inhale for a halfway lift. Exhale, left foot forward, right foot back, come to a lunge on this side. Blocks under hands can be very nice to help you have enough height for the movement that we're trying to do. So bend your knee and then begin to straighten your front knee a little bit. So it's okay if you don't go all the way straight. This is a very long Parsvottanasana leg, so it's okay to just land in your range of motion. Come to your endpoint. Don't shy away from your endpoint, but don't plow past the endpoints of your range. Let your body open patiently instead of force. A lot of force in our opening is part of the problem with sacroiliac joint issues. So we want to always be aware. Where is our range of motion? Do you feel the stretch in the belly of your muscles? Breathing back and forth. All right, and then once you're ready, stabilize the legs, put your feet in a place that's going to support you best. So that left foot might want to come wider, see what's right for you. Come up to crescent lunge. The back leg can straighten without hyperextension. Experiment, feel into the sacrum. Internally rotate the thighs and widen the sit bones. Maybe lean forward just a little bit if you tend to really compress the low back when you come up. Find the integration of the core to help you not compress the lumbar spine and sacrum. Lift the pubic bone toward the navel, hug to the inner, remember that block we had between our thighs and the pelvic reset. Hug to that imaginary block between your legs. All these things can help you stabilize your pelvis so you have room and space in your spine. All right, exhale and release your hands down onto the ground, dog pose. Reaching back, inner spiral the thighs again, sit bones wide. Let's have a little pulsing of these isometrics. So pulse your feet wide and then release that and bend your knees some. One more time, straighten the legs, pull your feet apart, and then release. Come forward into a plank. Let's go ahead and hang out here just for a breath or two. Feel that integration to the core. Zip up from your sternum down to your ankles. Breathing well. Place your knees down onto the ground and find your way to the floor. Inhale, cobra pose, opening the chest. Exhale and come back down. Put one hand onto the other like pancakes and put your head down on your hands so you have a spot for your nose. Curl your toes under, lift your kneecaps up and spread your legs wide on the floor. Take a breath and only lift your legs up from your hips, not from your knees.
Extend the spine, feel your core support you. And then relax. Turn your feet out so the inner kneecaps are resting on the floor instead of the center of your kneecaps, and lift up again. So here's this external rotation along with the abduction. Stabilize your sacrum. Lift those legs, breathe, integrate with the core. That global support is preventing you from arching your back too much. Okay, and then relax. Pick up your legs, bring your knees back to hip width apart, and pick up your feet. And just windshield wiper your knees left to right. Let your back body soften a bit. Breathing here. Come back up onto all fours. Swirl things around, move your body, move your breath. Back to dog pose you go. All right, and then when you're ready, walk your feet forward. We're gonna come up to stand. Grab a block again and stick that block between your thighs. Feet are hip width apart if you can manage it. And we're gonna come down into chair pose. You know, a lot of times I have you use a block between your thighs for chair pose if your knees need stabilization, if you got a wonky knee. But for today, we're also using it for that sense of stabilizing the pelvis. Can you feel the pubic bone hug toward each other? Can you feel the balance across your sacrum? So you can bring your arms up or out or anywhere you want them to be. Draw the knees back into the hips, lift and spread the toes a little bit. Ground through the big toes and the inner heels, ground through the outer heels, gently hugging the block. And then stand up straight and tall, open your breath. Back you go. This time, put your hands on the outer knees. Draw your femur bones way back. Stick your fingers out so your sit bones are wide. And we're gonna press the hands and knees into each other. Ground the big toes and the inner heels so we're not moving into our outer feet only. See if you can move the feet and the knees apart as you press your hands into your knees. Draw the knees way back into the hips so we're integrating into our pelvis. How's your breath? You notice dominance. And then release that. Arms up to the sky. Take a breath in. Keep the block. Fold forward, Uttanasana. Inhale for a halfway lift. Feel the block roll backwards a little bit. So if it was going to slide out, it would slide out behind you. And then relax. Step back. Little tiny steps. Keep the block. Dog pose. Inner spiral the thighs. Feel that block. If it was going to go anywhere, it moves back just a little bit. Not enough to torque your knees, but enough to feel the inner spiral of your thighs. Widen the sit bones. Find your breath. See if you can hug the block and isometrically drag your feet apart at the same time. Balance those forces. Notice the stabilization in your pelvis when you do this. Come forward into a plank. Hold yourself steady. Inner thighs still spiraling. Feel the integration through your whole body. All right, and then we're gonna come down onto our knees, take the block out, come to lie down on your belly. Decide whether you want your arms up in the air or down at your sides. We're gonna do two things here. We're gonna do some cross lateral work. So lift the left leg and the right arm up. Find that stability across the pelvis. Integrate your core. Exhale and melt back down. Second side, lifting the arm and opposite leg. Breathe. Exhale. Come back down. Now we're going to lift everything up. You can have your legs wide. You can have them turned out. You can have your legs close. Just experiment with where you want your limbs to be. Arms and legs, everything's coming up. Stabilize through the core. Keep the back of the neck long. Breathe. Exhale and melt back down. Come up onto all fours. Swish your body around a little bit. A little swish and sway. Breathing here. Now, if you're skipping dog poses because your shoulders are like, yeah, I've had enough dog poses, then you can just come up and turn to the side of your mat. Otherwise, find your way to dog pose and extend the spine. Bend your knees some so you feel that length and reach.
Lift the right leg up in the air. Exhale and bring your foot forward to a lunge. Rise up and turn and open up sideways on your mat. Have your heels wherever you want them to be. So if you know your pelvis, your hips are a little tight, then try taking your heels to line up with each other, or maybe even wider than that. Your back foot can come forward on the mat as much as you want to. Bring the arms wherever you want them to be. Traditionally out to the side, but maybe your shoulders or your breath prefer your hands to be on your hips. Let's organize around our front leg. So root the knee down into the ankle, press the heel into the floor. See what it feels like to have the knee, the ankle, and the sit bone all line up on one track. Allow the pelvis to stabilize around that femur bone. So draw the femur bone deep into the hip, and then try to open up the pelvis. But the minute you feel your knees start to cave in a little bit, that right knee start to cave in, that's as far as you want your pelvis to go. Once you're at that place, inner spiral the thigh, take the femur bone back, soften the back knee so you can yield and press your heel into the ground. Where is your torso? So if your pelvis is turned a little bit to the right, make sure your chest is turned a little bit to the right as well. Try not to line up with the mat, line up with your pelvis. Drop your shoulders, find your breath. And then we're gonna straighten the leg for a moment. Just stretch through your side. We're gonna come into Parsvakonasana. So bend the knee, elbow comes down on the knee. It's very common for us to push the back hip forward into a lock here to help us support ourselves, and try not to do that. So see what you can do to draw that femur bone back, stabilize around the front leg. The heel, the knee, and the sit bone are on one line. Allow the pelvis to open to whatever place is available. Take the thigh bone back, inner spiral the back leg, adjust your knee or your foot to support that, and then maybe your arm reaches up in the air, maybe your shoulder doesn't like that and you'd rather have your hand out to the side or down on your hip. How is your breath? Can you feel global, crown to tail? Can you feel the yielding of your feet into the earth? And then come back up, spin around to the other side, adjust your feet. Maybe your hips tighter on this side, looser on this side. You know, do you have to have the same? You don't have to have the same foot placement on one side versus the other. As you bend your knee, allow your heel, your knee, and your sit bone to line up. So it doesn't matter if your knee is before your ankle, just don't let it go past your ankle. Find the placement that's right for your joints. Root the feet into the earth. Find the stabilizing forces, ground your heels. Once you have that alignment, open up your pelvis to whatever place you can stabilize still. Reach your arms out. Let your chest be your heart, be right over your pelvis. So you may not have your arms in line with your legs or with the mat. You might be off a little bit, and that's okay. Take the thigh bone back, the back thigh bone back, soften the knee, yield into the earth. Feel the crown lift, relax the shoulders. All right, and then as you are ready, go ahead and straighten the leg. Find your way into a reverse triangle pose. Just open up the ribs. And then back we go, placing the elbow down on the knee this time. Ankle, knee, and sit bone on one line. Extend the spine. Feel the back heel move into the earth so the crown can feel that rebound. Open up the pelvis to whatever place your front leg can support. Inner spiral the thigh and take the hip back. If you tend, but you can look back to your back leg and see if your hip joint is in line with your ankle joint. If your hip joint's way forward, take it back. Maybe your arm comes up in the air, maybe it doesn't. Do you have even weight through your feet? Can you soften the shoulders down away from the ears? Is there even length in the two sides of your ribs? All right, let's go ahead and come back up out of the pose. Turn your feet forward and just notice your sacroiliac joints. You know, when we don't jam the pelvis in our standing poses, we have a lot more freedom Turn the feet forward, extend the spine. We're gonna bring our hands on blocks so that we have a lot of height, we have a lot of length. Draw the femur bones back, the shin bones slightly forward so there's ease in the knees. Widen the sit bones. Try not to overdo by going deep down. I mean, if your body naturally does that, you can do that. All right, and we're gonna turn back to the front of the mat now. 2 hands down, walk the feet back. Lift the left leg in the air to get that stretch through your front hip. Place your foot down onto the ground and find your way into child's pose. Have your knees either close or apart. What's gonna make your hips feel best? Can you find that sense of neutral? Breathing deeply. All right, let's go ahead and find our way onto our back. Okay. Rest your legs straight out just for a moment. Let's just come into a mini Shavasana. See if you can notice, do you have even weight of your pelvis on the floor? Is the back of your pelvis a little more alive? And you know, there's a difference in the sensation of your glutes being alive, your gluteus maximus, versus the muscles deeper than that. So sense in there as best as you can. And now we're just going to have some release through those muscles. So bend your knees, 2 feet onto the ground. Relax your femur bones into the hip joints. See if you can get the heaviness to drop down into the pelvis. Relax your shoulders and your spine. Take a breath. Release a breath. All right, so cross your right thigh over your left thigh. So here we are moving into abduction, you know, we're moving our legs past the midline even. And we're going to come into a little internal, rotation, but not very much. It's just a pretty neutral femur bone. We're just adducting. So draw the knees in. And this is a wonderful pose for your hip joint. You know, if external rotation is something that aggravates you, this is a nice compromise to pigeon pose. So if you've overstretched your ligaments or you're just currently having some challenges, this is a great way to stretch the piriformis without going super deep. Can you feel the stretch? Can you feel your hip stretch? Maybe widen the sit bones. Maybe drop the tailbone, nutate the sacrum, let the top of the sacrum lift away from the floor just a bit. And then release and relax. Stretch the legs straight one more time. Take a breath. And then we're going to cross the left thigh over the right thigh. So we're coming into some adduction. We're coming toward the midline, even past the midline. So this will stretch the piriformis. And let's draw the knees into the chest. So if you want to add external rotation in this pose, instead of the kind of neutral femur bone, you can walk your hands down your shins and start to pull your ankles toward your hips or toward your shoulders. And this will externally rotate the legs, which will deepen the stretch in the piriformis. But be very mindful, where are you going and why? You know, do you need that to stretch the piriformis? Widen the sit bones. Breathe deeply. Okay, and then go ahead and relax your feet onto the ground. Now we'll come into a reverse pigeon pose, which is, you can do pigeon pose if you want, and that's totally fine. Just make sure you're supported well. But for reverse pigeon pose, we're going to put our right foot on our left knee, and you can decide whether your left foot needs to walk further away for less stretch. You can walk your foot in for more stretch. You can put your left foot up on a piece of furniture or a wall, and that's a really nice way to practice this pose because your upper body gets to stay nice and relaxed. But if you don't have a wall handy or a piece of furniture, you can reach back and grab your hamstring or your shin with your hands and draw your knee toward your chest.
The other knee moves away a little bit from your shoulder. See if you can stretch through the big toe and the inner heel of that right foot, and try the pelvis again. Notice if you rolled the pelvis, if you're rolled into a posterior tilt. Widen the sit bones. Feel nutation of the sacrum, and this will enhance the stretch a little bit more. And know, are you feeling the stretch in the belly of the muscle, or is it torquing on your SI joint? So really try to sense, what are you feeling? What is the sensation that you have? Where are you doling it out just right, where you're staying and stretching muscles instead of trying to pry open a joint? Sometimes this is hard to feel. So if you're not sure, back away a little bit from something and just see, as you move deeper into a stretch again, where do you feel it? All right, let's go ahead and relax the legs. You can stretch them straight out or just switch sides. Left foot's going to come on right knee. Decide how deep in the pose you want to be. Maybe your foot stays on the floor and you don't draw it in. Maybe your foot comes onto a piece of furniture. Maybe your hands interlace behind your hamstring or to the front of your shin. If you are interlacing your hands, be really mindful to relax the neck, to feel the sense of ease. See what it feels like to stretch your big toe. Left big toe stretches, inner heel stretches. Notice if you get wonky in your pelvis. If you try to lift one hip or tip to a side, see if you can keep that sense of balance as you sweep your awareness across the backside of the pelvis. Widen the sit bones if you want a little something deeper. Maybe you don't need something deeper. How is your breath feeding your stretch? All right, let's go ahead and relax. Come out to a starfish, limbs wide, stretch open, and then exhale and bend your knees, feet on the floor. Lift up your hips and scooch them to the right a couple, 3 inches. Bring your knees toward the chest and drop them to the left. Open up your chest, turn your head to the right. Remember, if this is too deep of a twist for you, you can always put a support like a blanket or a block underneath your shins. Find your breathing. Inhale and lift the knees up. Back to neutral for a moment. Lift your hips the other way. So go left, bring knees up and drop right. Support anywhere that needs supporting. Maybe you need support underneath your left arm. Maybe you need support underneath your right shin. Just see where you're able to be comfortable on the floor. Let your breath be your friend. Let it open you. Feel the fullness of your inhale and your exhale. All right, and then come back to center. Bring your knees into your chest. Perhaps this is enough. Perhaps you want happy baby pose to stretch your back a little bit. So whatever, you can even do some, rocking plow if you want. So whatever feels needed in your body. And then just for a moment before Shavasana, take 2 blocks, take them to the outside of your hips, take the soles of the feet together and support your hip opening in Supta Baddha Konasana. So you can have the blocks on a middle height, a low height. If you don't like the feeling of blocks, grab some blankets or pillows. We won't be here long. Just want you to get a sense of balance. And with the support, there shouldn't be too much stretching. This isn't about stretching. This is about resting into an open awakeness of your pelvis, or an awake openness, I should say, of your pelvis. Travel the breath. Let it travel to the sacrum, to the pelvic floor. If you feel like you're too low, Bring the blocks higher. Remember, this is not about a deep stretch. This is about just softening into openness. All right. Bring the knees in. And as we come to Shavasana, decide what kind of support you need. Perhaps you want a chair or a couch like I have, and you want to put your calves up on something. This can be very nice to root the femur bones and let them rest in the hip and give some weight to the pelvis to relax. You can be straight on the floor. You can have a bolster underneath your knees. You can do whatever you feel good doing. If you have a sandbag, you can place it across the low belly. If you're cold, put a blanket over you. Whatever you need to feel at ease. This is your gift to your body and to your mind. So take the time to have it be perfectly wrapped so that you feel your best. And once you have that level of comfort, can you drop? Can you drop the limbs? Feel the weight of your legs, the weight of your arms. Can you feel the spine? Can you rest the spine on the floor? Is there a sense of ease across your face? Can you soften the skin? Can you drip the outer corners of your eyes toward your ears? Can you rest the jaw and the tongue? Can you feel your breath? Soft, soft belly. Soft pelvis. Feel your sacroiliac joints become deeply at ease, resting your pelvis on the floor, sweeping the breath through the pelvis.
As you are ready, you can begin to deepen your breathing again. Rest your body for a moment and feel the awareness of your body at rest, melting into the earth, the support. And as you're ready, see what it feels like to move, whatever it is that feels best to move. And then eventually finding your way onto your side. So there's a moment to be had to kind of gather yourself, prepare for moving into what's coming in your day. And as you come to sit up, find a comfortable seat for a moment again. And let's feel as you come to sit the center of gravity in your pelvis right now. Can you feel this deep grounding? Allow your breath to be free. Place your palms together at your heart. And let's offer our prayers, our intentions outward. Come from this centered place and offer your energy to another. Namaste. Thank you, everyone. Thank you for being here.